Well, Mary-Louise McLaws is a WHO advisor and a professor of epidemiology. She joins me now also from Sydney. And Mary-Louise, good to have you on the program with us again. It was only less than a month ago that Australia, it looked like, had a handle on the situation. Are scientists surprised by how quickly the coronavirus has started to spread again there?
Yes and no. Nice to be back on your program, but yes and no. Um, Melbourne has a unique problem. It had, as your previous speaker had mentioned, an outbreak in the quarantine hotel. We believe that there will be genomic sequencing evidence to come to the public that will suggest that during that breach, a particular strain from overseas then entered into the staff, and then they then took it into the community. So had there not been a breach, I believe that Australia and Melbourne would have been able to contain very small levels. But then, of course, in Melbourne, it spread into large family clusters and then spilt over into retail. And then, of course, we believe that genomic testings will show later whether or not it also spilt over into some health professional carers in residential aged care facilities and hospitals.
Mhm. Is this a cautionary tale for other countries that are watching what's happening in Australia as they try to get a handle on the coronavirus and then move into winter in the northern hemisphere? Is this something that we can expect to see more of, other outbreaks elsewhere?
Absolutely. I mean, this one was particularly unusual, but certainly overseas can learn from what's happening in Sydney. So there was a traveller from Victoria, came up and then stayed in and drank at a hotel that is quite well known for travellers to have some respite. And then they went to all areas, geographical areas around Sydney. So yes, it's small numbers that can be contained, but there are no hotspots. That's the difficult part, because the hotspot is actually the social clubs. And the same thing happened in South Korea. So they're the areas where if there's going to be a flare up, there will be, because there are lots of numbers. So the Premier has quite wisely reduced the numbers in those clubs, but particularly also she's included what's called COVID-safe marshals that will be going around those clubs to make sure people keep their distances and that they don't wander around and mingle, that they stay seated. And that's some way between keeping this the club still open, but also stopping spread further, as we've seen in other countries and now Sydney.
I know that in New South Wales, authorities have had trouble tracing some clusters. So why is it so critical to be able to trace the origin of these individual outbreaks?
Mm. One reason that they want to trace the origin is so that they can feel confident that they can actually do contact tracing well and stop any secondary and tertiary cases. So that's one reason that they do it. The second reason is to know that there's no silent background adding to the infection with a large, untapped, unknown, asymptomatic group. And that's what we think has happened in New South Wales, that it's from this imported case from a different state. And therefore, the numbers are relatively small, but as I mentioned, quite widely dispersed geographically. That will be difficult, but because there are few numbers, they should be able to contact trace and prevent, tertiary spread from potentially secondary spread as well.
All right, some very helpful information as always. Mary-Louise McLaws, thank you so much.